So, how do you treat patients with both Lyme and mold toxicity?
First, this question is very interesting. Why? Because we estimate that in 80% of times, mold is associated with Lyme. Because mold is very common and Lyme is very common, very simple. But the point is that someone suffers from mold, and everybody in the family looks at the person like a crazy guy because it's the only one who complains of mold, and everyone is under the same roof. They are not sick. I say yes, because you don't have Lyme. She or he has Lyme. That's why mold has a grasp on him. Lyme is immunosuppressant, mold is immunosuppressant, so Lyme and mold activate each other. And that's why the worst case of Lyme is, we estimate that 80% of time there is some mold involved. So your question is, of course, very important, because when we treat Lyme, we look for other associated factors, aggravating factors. Lyme is rarely alone. That's why Lyme patients differ a lot from one another. And mold toxicity is a biggie. So in my training, I asked this question to an expert. I will not give his name. I don't know if you would agree. And I asked him, if you have mold and Lyme together, what do you do? And he told me, I treat both. And I said, but he will never know if the patient suffers of mold and Lyme. He said, who cares, as long as it's better. So I understood that it was sarcastic, but I understood that after 30 years of practicing Lyme and being one of the leaders of Lyme, that he wanted maybe to tell me, you will never find out if it's more mold or more Lyme, so just treat. When we asked this question, Dr. Neil Nathan, who is one of the top leaders in the mold world, and he said mold first, and he explained, and he agrees with the other doctor to treat both. But he said like this, that mold people may be very sensitive, and mold people and Lyme people may not tolerate both. So if you want to start by something, start by mold. So my take on this is to say that if someone is very sensitive, very toxic, you start by detoxifying. Can I say something in addition to that?
Yes,
Can I
please.
add something?
Yes.
One of the major problems of Lyme treatment today, from a Lyme doctor's perspective, is not to heal patients. Today we have bombs, we have treatment, and we can have time. We have to review the newest weapon that we have for Lyme, to the point that is no longer a concern, really. Everything is God's hands, but I would say that by experience, the success rate is phenomenal compared to 5 years ago. The concern is Herxheimer reaction. Herxheimer reaction is what? Is everything is as if the Lyme bacteria would release toxins from its belly randomly, usually, and the Lyme goes by flare-ups, so chronically, but by the release of toxins. This is spontaneous due to the bacteria. Now, when you take a gun and you shoot the bacteria explodes and release all of its toxins into the body. You have just provoked a flare-up of Lyme. It's called Herxheimer reaction, and is when people come to see you because they have a knee pain or headaches, and they take doxycycline and they have a much worse knee pain, and now they cannot walk, or they are so tired, and they have all these Lyme symptoms that emerged that become worse with the treatment. So we said, this is a Herxheimer reaction. And some people will tell you this is the best proof that it's Lyme. Because if you have if you are depressed and you take doxycycline, which has nothing to do with psychiatry, and your depression is worse with doxycycline, or if you take Z-Pack, and you become totally psychiatric with CPAC, you ask your doctor, he would tell you, in 30 years, I've never saw that. Okay? If you have Lyme, you have just caused a Herxheimer reaction. So the aggravation of your symptom is actually the way the bacteria tells you, yes, I was there. You kill the bacteria, now the toxins of the bacteria are out, and you have an exacerbation. And this is a concern because when someone has a knee pain, he has a Herxheimer reaction, he may have such a knee pain that he cannot walk. Someone who is depressed, anxious, or psychotic, if he has an aggravation, he may find himself in the emergency room. It's a psychiatric emergency because he may have a psychotic episode, hallucinations. So we are very careful when mental problems occur with Lyme, with a Herxheimer reaction. When Herxheimer reaction happens typically 2 weeks after the beginning of the treatment. But it may happen on the same day, or it may happen 2 or 3 days after. So why there is a difference is because if you are toxic, if you are full of pesticide, glyphosate, you are full of plastic, of mercury, lead, your body struggles to clean himself. Now you come and you pour a bucket of dead bodies of bacteria, it gets overwhelmed and you herx. We say herxing. We have created a word to say that it's so common. Herxheimer reaction is very common. So sooner you have a Herxheimer reaction, more toxic you are. That's why we like to detoxify before or with the treatment to minimize the Herxheimer reaction. So now if you come and you have mold, and depending how much of mold you have in your body, if you live in a very moldy environment and you are already overwhelmed by mold and by many mycotoxin, which are the toxin produced by mold, if you take a Lyme treatment, you may just not do very well. So that's why to answer your question, is a correlation between the toxicity, how toxic you are, and how Lyme, if you allow me this expression, you are.
Okay.
Ultimately, you need to treat both.